Welcome. My name is Daniel Rasmussen. I'm with the founder of Pinnacle Integrative Health. This is an educational seminar on regenerative therapy and exclusively at Pinnacle Integrative Health. We are going to be talking about the GPF method today. A little bit about me. Who am I? Daniel Rasmussen. I'm a national board certified diplomate of Oriental medicine and a functional and integrative medicine specialist. I'm nationally board certified. I founded Pinnacle Integrative Health in 2010. So we've been in practice for almost 15 years, treated over 30,000 patients in our history, and we have a very high success rate with our programs, nearly 90% success rate. And what makes our practice unique is we have an integrated Eastern and Western approach to health that's holistic based, treating the root causes, fixing the problem, not masking them. And this is our team. You'll meet them soon. On starting from the left is Jared Erickson, our orthopedic specialist, myself, Daniel Rasmussen. Below me is Maria Laura, also an orthopedic specialist and regenerative medicine specialist. Next is Oliver, our medical case manager. And then we have Tam, who is the patient care coordinator. So we've been have won several awards. We've got top doc international national award recognition. And then we've got a recognition on USA Today, where we were recognized for being innovators in the world of regenerative medicine, leaders in this field. And mentioning USA Today even mentioned our GPF method process. So we're very grateful to have that recognition. And we're excited to share this information with you. So, little disclaimer at first. Of course, this information is not intended to diagnose, treat, or cure any condition, illness, or disease. This is just for educational purposes only. So, any evaluation needs to be done in person at our office with our medical team. Let's first talk about contrast to the conventional medical system, which is the route that most people are on. You have pain or some kind of symptom, you go to your doctor, and they just recommend or prescribe non-steroidal anti-inflammatory drugs, which is like ibuprofen, Tylenol, Aleve, naproxen, Celebrex, whatever they give you. And when those stop working, your problem's getting more painful, it's degenerating, it's getting more inflamed. Those drugs are no longer working. They give you stronger medications. And then when those stop working and your problem's getting worse, then they say, okay, now let's do an X-ray. And this is following the insurance model. So the doctors, it's not their fault. They just have to do what the insurance dictates them to do. So otherwise, they skip these steps and your insurance denies and you're left hanging with the bill. So then they can do X-rays after you've failed some treatments. The X-rays show arthritis, and now they can prescribe a treatment such as cortisone injections. And then when the cortisone injections are given every 3 to 6 months over a period of time, each time those injections are giving less and less relief for this reason. Not many people know why, is because it is eating away at your cartilage, at your tendons, at your ligaments, and it's making it worse. So when the pain comes back, it's worse than ever, and you're going and begging for another dose just to get any kind of relief. And then they finally say it's now your knee is gone, your shoulder's gone. Now you need surgery. You need to replace that. So if you're looking to avoid that, first of all, the first step is to avoid and deny treatment with any steroids. Just say no to steroids, because this landmark study showed that steroid injections increase cartilage loss. So they're doing more harm than good. So the old way of thinking is, let's just wait until it gets worse and then we'll do something. wait around and wait and see method. That's a degeneration healthcare. It's treating the symptom reactively after you have a bigger problem. It's like waiting until your engine blows up in your car to then say, well, maybe we should have changed the oil and done some maintenance on it. This leads to a deteriorating quality of life with pain and immobility. Who wants that? This medical system that we're in, is ruled by FDA, Medicare, and insurance. And so it treats all of us to be in the mindset that I'll only get whatever my insurance covers. And if it doesn't cover something, then I'm not going to get it. Well, where does that leave you? That leaves you with three options. And this is it. Your insurance covers pain meds and drugs, surgery, and physical therapy. And that's it. Those are your options. Contrast that to holistic regenerative medicine. This is a shift in mindset. It's for those who want a minimally invasive option, who want a holistic, non-drug, non-surgical option that's long-lasting and permanent, that fixes the problem, not masking it. It's for those who understand that it is an investment in their health, and it's for those who want the future of medicine to be now, to be available now, not 10 years, 20 years down the road. Well, let's look at what the knee surgery statistics are. You've got after you're there at that point where you're looking ahead and you're looking at some friends who, you know, out of 10 people, five of them had good results, the other five didn't. So it's literally a 50-50 crap shot. There's no guarantee of outcomes. There's a high risk of failure and issues with parts. They might react with your body. Who knows? There's just a myriad of reasons why it can fail. You have downtime, you have loss of function, you have to take time off of work, 6 months to 12 months. Who can afford that? And in addition to that, your average co-insurance for in the United States, which is going up every year, the average out-of-pocket co-insurance for patients is 10,000 to 20,000 per surgery. So if you've got both knees, I mean, you're looking at a massive investment for the surgical co-insurance, a part of that. Surgery isn't much better. You've got no guarantee of results. It's a very complicated surgery and a high rate of failure. So let's look at the new way of thinking. Regenerative therapy is not degenerative, it's regenerative. Why do we need it? Well, degenerative treatments like non-steroidal anti-inflammatory drugs and steroids just make it worse. They're just treating the symptoms. They're not fixing the problem. The goal in regenerative medicine is to intervene in that process early on, not when it's after it's degenerated. Get it as soon as possible. Now, if you're, fairly long advanced, doesn't mean you're not a candidate. I always recommend coming in, get an evaluation with us. We're the specialists. Get our second opinion. You don't want to get a second opinion from a surgeon for regenerative therapy. You want to get a second opinion from a regenerative medicine specialist to see if you're a candidate. And so regenerative medicine isn't based on nature. It's the power to help tissue heal and repair for the long term. It's really simple why we need it. We need an alternative. So the GPF method exclusively at Pinnacle Integrative Health. So this is our process. This is the only non-surgical method to get pain-free and get your spark back. So this is a process that we've developed over 15 years, working with over tens of thousands of patients, learning and iterating and making it better and better and better. And this is the ultimate culmination of what we have at this point. The first step is to remove inflammation. Second step is to support structural support to the tissue, the cushioning of the joints, the connective tissue, the cartilage, the meniscus, rebuilding and stimulating the repair of those tissues. Third visit is to restore the function of your muscles, your nerves, your ligaments. Fourth visit is to rebalance your body left to right in the gait. Fifth step is to refer you out to physical therapy, which is called stabilization. Then we have a 3-month follow-up and a 6-month follow-up on the way to a 1-year goal of restoring function, getting pain-free, improving your quality of life, and just surprising and delighting our customers and our patients with those outcomes. So the first step, let's deep dive. First step is with alpha-2 macroglobulin. This is a protein that's obtained from drawing your blood. We spin it, then we filter it through a micron filter, and it cleans it and purifies it down to this little X-shaped protein here in the yellow. And what it does is it's injected into a joint, in those tissues, and those little green proteases, think of those as Pac-Men, and they're chomping away at your cartilage, deteriorating it. This is known to be the number one driver of osteoarthritis now. This yellow protein latches onto them in the middle picture there, binds to them, traps them, and now we can circulate through the bloodstream, circulate those little proteins out of the joint, out of the blood circulation, and out of the body, effectively stopping and removing the inflammatory damage of arthritis, drastically reducing pain. And this is basically preparing the joint for the second step, which is repair and regeneration. So we're now going to start fixing the cracks in your cartilage, fixing the broken meniscus, rebuilding that cartilage. And, a building only can go as high as the foundation is deep. So we want to get that foundation rebuilt, all sealed up and fixed. And what do we do that with? We do that with Wharton's jelly, which is the part of an umbilical cord from a donated birth after a healthy, successful C-section. Healthy mom, healthy baby, no harm to either. The donors are screened. 8 out of 10 are disqualified. So these are very hard to come by because they have to be the best of the best primo. And these stem cells can then be extracted and concentrated into an injectable, flowable form. Once they're injected, they're universally donated to anyone because there are no antigens on the cell surface. So there's no way your body will reject them. They're young, they're vital. They don't care how old you are or how young you are. They work. They are the young guys doing the workhorse lifting, pulling the heavy load. They're safe. They've got over 500,000 treatments nationwide since the mid-aughts, middle of 2000s. And there have been virtually no adverse reported events. They're extremely safe. Just to contrast donated stem cells from umbilical cord versus your own stem cells from your own bone marrow, because this is an option. There are other doctors out there that are performing bone marrow stem cells. They take your bone marrow out through a painful surgical procedure. They suck out your stem cells and then they inject those into your knee or shoulder. Well, according to research, landmark research shows that by the time you reach age 50, your bank of stem cells decreases to the point where it's negligently there. So they're just basically injecting a temporary fix for a very expensive procedure, and you don't get the regeneration. Maybe if you're in your 20s, this will work phenomenally, but above 30, you're just not going to get the results. So we always kind of contrast that, there's two types of stem cells. There's donated from umbilical cord, and then there's your own stem cells from your own body. And the fact that they're declining, they're also as old as you are, whatever your age you are, your stem cells are the same age. They grow, they age. They're get up and go, got up and went. So it's not really a good option. So stem cells, how do they work? Well, they sniff out inflammation. They move on into it like a hound dog chasing a raccoon, and then they release the signals, the tissue growth factors to stimulate your cartilage, your meniscus, your tendons, your ligaments, your blood vessels. They release all those specific tissue factors based on an SOS call for help from your knee. Those stem cells migrate to that SOS signal and then go to work releasing the signals. So it's all about signaling. In fact, stem cells, Dr. Arnold J. Kaplan wrote a landmark study saying we should change the name to medicinal signaling cells because that's what they do. They signal the tissue regeneration. So this Wharton's jelly is injected into the knee joint. We can see the left versus the right where you have a healthy cartilage restoration. When you restore and you treat the tissue function, the pain automatically goes away. The function automatically gets better and you're back to mobility and being pain-free. On average, most patients feel the healing process taking place within 6 to 8 weeks. But the whole process will continue on for almost a year because the stem cells double every 24 hours for 250 to 300 days. So you've got healing that's taking place. By the time you're at the end of a year is where you'll have the final outcome of where you've reached maximum improvement with this particular course of treatment. The goal is regenerative. Now we've injected the stem cells. Now it's time to treat the muscles, the tendons, and ligaments around the joint for inflammation and dysfunctional compensation factors. You've got restoration of that tissue function using platelet-rich plasma, which is a blood draw. We spin it down to the platelet, and then we take that little yellow part of that test tube there, we pull that into a syringe, and then we inject that into the muscles, the tendons, the ligaments, where there's pockets of inflammation and dead blood. And that stimulates those platelets to think of it like fertilizer for healing. Any tissue wide is going to respond. Step 4 is rebalancing the function of the nerves, the tendons, the ligaments, and the left and right balance of the body. We use ozone injections, and this is also targeted for inside and outside the joints. It is extremely safe. Ozone breaks down once it's injected into the tissue, it breaks down into oxygen. How important is oxygen in the healing healing process of tissue? It's extremely important. So this is basically, think of it like hyperbaric oxygen therapy, but we're directing it toward those specific areas where you're inflamed, whether it's your shoulder, your back, your knee, your neck, etc. Finally, to tie all these treatments together, each one of these visits where you're getting injection therapies, in addition, you're going to be put on what's called a flow presso. This is an FDA cleared medical device that stimulates powerful lymphatic circulation and lymphatic drainage. The lymph system is what carries toxins and inflammation and cleans out your system. It's the basis of your immune system. And it gets this circulating, all of this inflammation to pump it literally out of the body. We see some patients lose up to 5 to 10 pounds of water weight just from inflammation being drained off their body. It increases blood and lymph circulation. It drains the inflammation toxins out of the body, and it cleans up the internal body environment, supercharging it for healing process, reduces pain, and speeds up healing. The 5th stage of our process is we give you a prescription to go to physical therapy somewhere near home. And the obvious benefits to that is when your body starts to heal, your brain will start to allow those muscles to strengthen and turn back on. And once those nerves are firing again, they'll let those muscles rebuild. If you've been avoiding the use of that knee or that shoulder to avoid the pain, those muscles have atrophied, and you have to build those back up and stabilize those so that you can get back to doing the things you love to do, staying fit, staying active. This treatment is not for the goal of sitting on the couch and being sedentary. We want you to be active and out there enjoying life. So again, a quick review, recap of those 4 visits. Again, just a reminder, this is not a cookie cutter approach. Some people, based on their severity, will need if they're more severe, are going to need all 4 visits. But it is a very efficient treatment process. Usually the maximum number of visits to our office is of these 4, but you could have as few as 1. So it just depends what you need based on if you are qualified as a candidate and you proceed to go forward with the treatment. We are also going to give you training and support and guidance in nutrition for healing, for energy, for anti-inflammation, so that you can look your best, feel your best, and perform your best. This picture is just a very, general example. We will go into much higher detail, so just don't worry about these. This is just to give you the concept that we're also going to support your holistic health through this process. Some of our patients, we even will suggest running a comprehensive blood lab so we can see nutritional deficiencies and customize any supplement recommendations. And even some of our patients have even gone into our more advanced next level health programs called our advanced signature health program, which we can answer questions about. But that is a complete inside to outside, head to toe health transformation for those who are looking to optimize their whole health in addition to their joint and orthopedic health. A little before and after. This is one of our patient case studies, x-rays. On the left there, you can see just about bone on bone. The joint space is getting narrow. On the right, 12 months later, he's got more joint space. So this is an example. Doesn't mean a guarantee this is going to what's going to happen for you, but this is a great example of restoration of and reversal of osteoarthritis. You can stop the arthritis and reverse it and grow that tissue back. A lot of our patients are leaving, we encourage people to go look at our Google review page, look us up on Google, look at our reviews. That's probably where most of our patients' testimonials are. So please take the time, look us up on the Google listing page, and then read our patient reviews. We've got over almost 60 reviews there of patients who have done successful. Not everybody I have thousands of patients that have gone through, the few, these are unsolicited. So, people that were very appreciative of the results they got with us. That's our landing page there, just so you know what it looks like. And why don't we just listen to a couple of these really quick video testimonials of our patients.
So I had been experiencing a lot of hip pain and shoulder pain, and found myself withdrawing more and more from my active life, and decided I really needed to do something. I had been researching several things, several avenues, and chose stem cell therapy, and went to the seminars, did all the things that suggested that we do, read some articles, understand what the whole process is about. And so I went in, I had the treatment, and I tell you, it makes me cry. The really sharp pain that I had been experiencing stopped after a few weeks, which I didn't expect. I didn't expect any of it. That quickly. I mean, gradually, I tell you, I'm much, much, much more active. I'm happier. I'm a happier person. I think pain requires such a vast amount of energy just to maintain your personality through it. Now, after 2 months, I am getting up from a sitting position. I'm getting in and out of cars. I'm doing all kinds of things that I used to dread. I used to prepare myself for. Now I just do them. I'm glad I did it.
All right, that was Elizabeth. Unfortunately, you can look up these, all of these. We have over 50 reviews and testimonials on our YouTube. So if you go to YouTube, look up Pinnacle Integrative Health, you can see tons of our patients' success stories recorded on videos on our channel there. So unfortunately, we don't have time to play all of those.
So I had been experiencing a lot.
Okay, so thanks for watching this. A couple of things, housekeeping. If you haven't yet filled out your online patient intake form, please get that filled out. Make plans to bring your spouse with you if you have a spouse, because you got to get the whole team involved. And this is a process where if your spouse understands what is going to be needed, they can be supportive. We find that people who have their support partner with them get about 30 to 40% better results because they have that support network with the family. They got the whole team involved. And make sure you make plans to arrive a few minutes early, not late. We run on a very tight schedule, and then so if things are running behind, it really impacts the rest of our other patients on our schedule for that day. With that, I look forward. A whole team looks forward to meeting you and seeing if we can help. And we appreciate you taking the time to educate yourself and learning more about this process. With that, we will sign off and to see you very soon at the clinic.